My name is Sally Lyles, and I'm going to perform my cardiovascular and pulmonary assessment today. First, I'm just going to inspect my patient and make sure that his ease of breathing is effortless and produces no noise while he is breathing. And also just watch his chest and make sure that both sides are symmetrical as well. And then as I'm looking at this, I'm also going to be looking for the configuration of the thoracic cage and just make sure that it's within 90 degrees. Some patients, if they have breathing problems, they could have a lot wider of a chest, and that could, if we notice that, that could cause concern for us. Next, I'm going to, like we always do, we're going to inspect, palpate, and then auscultate. So I'm going to palpate, and I'm going to do the symmetric expansion, and this is where I just place my thumbs on the costal margins, and then I'm pointing toward his xiphoid process, and then he's just going to breathe a few times normally. And I'm just watching for my thumbs to go out towards me and just make sure that they're symmetrical and moving with ease. And then next I'm going to do my tactile formatus, and that's where I'm going to just touch on both sides, and I'm going to have you, and I'm going to feel for the vibrations as he says 99. So say 99.
99.
Say it on this side.
99.
99.
99. 99. 99. 99. 99. 99.
Okay. And I just, whenever he was saying that, I noticed that the vibrations in his chest were equal and normal on both sides. And then as I'm touching here, do you have any tenderness or pain?
No.
No. And then at this point also, I'd be, as I'm palpating, feeling for any masses, and if I did feel something, that would be a rise for concern, and we would need to look into that further. And then next I'm going to have my patient turn to the side so I can percuss his posterior lung fields. And then as you do this, you just stick your hand on your patient's back side. You turn a little bit more. And then you're just going to hit your at your joint on your finger here and here. A noise, and the lung fields are hollow, and so you'll just hear a hollow noise as you percuss. And then as you get towards the bottom, you'll notice whenever you don't hear, you're not in the lung fields anymore because it's a dense sound as you percuss. Okay, and then next I'm going to have you turn to the front again. I'm going to auscultate each lung. I'm going to auscultate each lung field and make sure they're clear and equal bilaterally, and I don't notice any wheezing or crackles as I'm listening. Okay, and all of his lung fields are clear and equal bilaterally, and when you listen, auscultate, you want to make sure that you are listening for full inspiration and expiration. Next, I'm going to perform the whisper pectoracal bronchial phony. Sorry, I can't say that very well. And as well, when I'm doing this, I'm going to auscultate the posterior lung sounds. Okay, and then whenever I'm listening here, I just want you to whisper 1, 2, 3 as I place my stethoscope on your back.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
And just breathe normally. Okay, and all of his lung sounds on the back are clear and equal bilaterally, and also whenever I did the test, it was the same sound in each lung field. Okay, so next I'm going to move on to the heart. I am going to palpate his carotid artery. And I'm going to do that on both sides. And next I'll auscultate his carotid artery, and I just want to hear good whooshing of blood, and if I were to hear anything else, that could be a rise for concern, as that could mean that there was occlusion in the carotid arteries. And when you listen, you want to make sure to listen with the both ends of your stethoscope, just to make sure that you can hear it correctly. And also, whenever you listen, you want to have your patient breathe in really big and deep and then hold their breath so you can hear the carotid pulse accurately and you're not hearing the breath sounds from the trachea. You breathe in big, deep, and hold. And exhale. Breathe in deep and hold. Okay, exhale. I'm going to listen to the other side. And then we'll do that again. Okay, breathe out. Okay, and I didn't notice any bruit or other sounds that would raise concern for blockage. Next, I'm going to auscultate all 4 of the heart valves. So we're going to do S1, and this is the AV valves closing. And then S2 is the semilunar valves closing. And then next I'm going to palpate and feel for the apex of the heart, and I'm going to just feel where his clavicle is, and then slowly work my way down to the 5th intercostal space. And that'll be in the, feel down to the 5th intercostal space, and then you'll go to the mid-clavicular line. And when you listen to the apical pulse, you have to listen for 1 minute. So I'll do that now. Okay, and his heart rate is 76, and the heart sound normal, and they are regular. This concludes my assessment of the cardiovascular and pulmonary systems.